Hi everybody, welcome to the tutorial for the Multiple Micronutrient Supplements Implementation Plan Costing Tool. In this tutorial, we'll walk through this tool that was developed to help cost multiple micronutrient supplement implementation plans in your country. To note, we have dummy examples of inputs throughout the tool for example purposes only. Please delete the example activities and inputs and put in your country-specific inputs when using the tool. Starting from the beginning tab, the version of the template and the date that it was last updated by the developers is on the cover sheet. Overall, we've tried to keep the tool as simple and easy to use as possible in both how it's built and in how you use it. And the latest version that has been uploaded is version 2. If it shows a later version, then it has been updated since then. The second tab overviews how this tool works. And in short, the tool's purpose is to support country stakeholders in costing their MMS implementation plan, to identify the funding requirements, inform the development of a financing or resource mobilization plan, and to serve as an aid to continue to update your country's costing and financing plans. This tool is not a cost effectiveness or cost benefit tool. It is meant to support the costing and calculation of MMS funding requirements. And it is also important to note that this tool is meant to be used for a defined geographic area, for example, nationally or a specific province or state. It does not enable differentiated costing of multiple geographies or sub-geographies within this actual tool. And you'll see more in the outputs tabs, but the tool's outputs are the cost of the MMS introduction and scale-up plan over 5 years, which is the default timeline set, although non-applicable years can be left blank, by year, by costing category, and type of cost, which we will explain a bit more. It also estimates the cost per pregnant woman reached in your country and how it changes over the course of those 5 years. To use the costing tool, there's a couple of different steps that is important to know. Your country's activity-based implementation plan should be organized into one of the 9 costing categories within this tool, which are overviewed in the next tab and we'll go through. These 9 cost categories are research and pilots, policy and regulatory, product procurement, supply chain, training and service delivery, demand generation, local market shaping, coordination and advocacy, and monitoring and evaluation. And essentially, within each costing category, you enter activity-based costs, which are determined using your country collected unit costs and assumptions. And there are individual tabs per cost categories. And for some of these activities, we have inserted calculation aids, for example, around product procurement, training and mentorship, and stakeholder meetings to help simplify those calculations. Costs are also divided into types of costs: introduction, transition, and ongoing. So introduction transition costs are expected in the earlier years of the implementation plan, although they do not have to be just in year 1. And these type of costs are required to introduce MMS into the country's health system and for scale up. Ongoing costs are expected to be recurring annually for ongoing delivery of MMS. And there's a bit more detail and examples of what those might mean there. Throughout the tool, we've provided user guidance notes in green, and where possible, the tool incorporates available baseline data references or suggested benchmarks based on available data. The rest of this tab overviews what each tab's purpose is, which we'll continue on as we go through the actual tool. In this tab, we outline the cost categories on the left with example activities detailed throughout. Your implementation plan may not include all these activities or be limited to these activities. We have also included the type of cost that these example activities would be considered as and the sample timeline in which they occur. But again, these are example activities and sample timelines to help give you a better idea of what could be included or should be included within the tool and within your work plan. Those cells that are highlighted in gray have calculation aids within their cost category tabs to simplify the calculation, and we'll go over these in the tabs themselves. To note, training and service delivery is targeted for healthcare workers, and it assumes inclusion of MMS delivery, including counseling and M&E requirements. Demand generation as a cost category is pregnant women, their family, and community facing in terms of the types of activities that would be included. For reference, this tab is just for informational purposes. It is optional, and we'll come back to it after explaining the base inputs tab. The base inputs tab is where we set all of the fundamental inputs that will cascade throughout the tool. So one thing that's important to note is the legend of the color coding of the cells. Any cells in gray are inputs, any cells in light orange are assumptions, and any cells in light blue are calculations. Calculation cells should not be touched, should not be manually changed as they're calculating an output within that cell. So to start off with, you select your country. For example, we'll pick Ethiopia, and then the scale of that geography that's included within the costing and the implementation plan being inserted. So we'll leave it at national for now, but you can enter a province or state and then enter what that province or state would be for that country. It can also be left blank. For now, we'll consider national. Based on the country being inputted, the tool will automatically populate the local currency and the conversion of USD to that local currency based on inputs that are included in the reference tabs at the back. And the particular source for this is IBAN based on live trade data. This can also be manually overridden and inputted. As mentioned, this tool includes a 5-year timeline, and so you input the first year of that decided timeline. So we have example of 2024, you could put in 2026, and it will change accordingly. Inflation rates for the purposes of the cost input calculations later on are included here. And again, these are pulled from IMF as a source, but can be manually overridden based on what you would like to put in. These only have to be inputted once and are incorporated at the end in terms of the total cost outputs. Then there's the calculation of the target population. The years are automatically pulled from the inputs above. Once you put the years in here, they don't need to be entered again in the tool. Then the number of pregnant women in that selected country is automatically populated from list and UN population data. It's considered live births and stillbirths, but again, this can be manually inputted and overridden based on the latest data that you might want to put in. If you have selected a province or state, then you will want to make sure to enter the number of pregnant women in that province or state or that target geography you have inputted, as that is not populated. It is not auto-populated. So please ensure that's entered if this is for a sub-geography. This entry is the percent of pregnant women in the target sector. So it is meant to take into account if this tool is meant to only consider the number of pregnant women in the public sector, for example. If so, then you enter the percentage of pregnant women in that target sector or population. Enter 100% if all women in the country are meant to be reached. Then you enter the assumption for the annual MMS target coverage of pregnant women. This is based on Ministry of Health or country targets and can scale up over the course of time. And that will calculate the number of pregnant women reached with MMS. These are important fundamental base inputs to calculate these target population inputs, as it helps understand what the cost per pregnant woman reached is going to be, as well as the amount and cost of product procurement that is applicable for the scale-up plan. This is an optional box to enter if you want to enter notes on the definition of the target population or target coverage for your country for context setting. Then these are the beginning of the activity-based costing by cost category tabs. Each of the cost category tabs follow a similar structure, and we'll go over it within research and pilots and then calculate or demonstrate the differences in the other tabs. The title of the cost category is at the top, along with a descriptor of what it should include. So for example, this tab calculates the cost of research and pilot related activities related to MMS pre-launch and implementation. Totals for that cost category are summed by year and type of cost in USD and the local currency, as well as by subcategory. This area of the sheet should not be touched, as it is all calculations. The inputs start here. If you scroll down to where it says cost inputs for each cost category, that is where we start entering inputs. First, each cost category allows subcategories that you can enter based on how you think that category would be split. For example, for research and pilots, we've entered example subcategories of operational implementation research, product acceptability studies, and academic studies. Other activities is included in each cost category as a subcategory and should not be deleted or changed, as this may always need to be applicable as a catch-all subcategory for activities that don't fit into the others. This table is where you fill out the activities that fit under this cost category, under research and pilots, for example, and it's structured similar to a work plan. You select the subcategory that is pulled from what you enter above. You type in your activity description based on what the activity is, select what type of cost it is, and then yes or no for where it is applicable in terms of which years it's applicable in. And then you enter the total cost for that activity. To note, only select yes for multiple years if the cost is the same for each year. If the cost is different for each year, then please enter the activity on a new line. And just to remind you, these are example activities. You would want to delete this and re-enter what is applicable for your work plan, for your implementation plan. Policy and regulatory is structured the same way. And to note, we want to include those policy and regulatory activities that are not included in the coordination and advocacy cost input tab. So this will not include stakeholder meeting activities, which will all be in the coordination and advocacy cost category tab. This is meant to be for any other policy and regulatory activities that may happen. Product procurement is a little bit more of an involved tab that we'll spend more time discussing. Product procurement includes the cost of MMS tablet procurement, including the product, shipping, and cost to enter the country. Pre-distribution to facilities, so this does not include distribution to facilities, and it is considered an ongoing cost only as it recurs every year. So you'll notice that introduction and transition is not applicable as we consider it an ongoing recurring cost. This tab includes calculation aids to help you. It allows entry of up to 4 procurers over the course of the 5 years, depending on the situation in your country. At least one needs to be entered, and these are examples that are put in. If others are not applicable, you just leave them blank. So you enter the procure name, the supplier name, the number of tablets per unit, which is usually going to be a bottle from that supplier, the X work costs per bottle or unit in USD, and this is an assumption that is put in, the landing cost multiplier on X work cost. So this is a percentage of the X work cost that is added to represent freight to country, insurance, duties, customs, clearance, taxes, storage, and any other administrative costs. Please note that this includes shipping and freight to country. Shipping and freight to country is not included in the X work cost. So we want to make sure that that's not double counted and it's included in this landing cost multiplier. And as mentioned, there's guidance notes for you, the user, on the right-hand side. Here, these are one-time inputs, the number of MMS tablets per pregnant woman for an average course, which we've assumed the default assumption is 180 tablets, and a product wastage rate, which should be based on the expected shelf life, expiry, and theft once the product is in ANC and average country benchmarks for similar products. We've assumed a default of 15%. Then, where you enter is in gray. You put in the percentage of pregnant women procured for by procurer. So for example, if we expect 100% of pregnant women who will receive this product to be procured from Kirk Humanitarian, then we put in 100% for procurer 1, which is Kirk Humanitarian. This is because there may be multiple procurers and suppliers per year, and so we're looking at what that split of product procurement is going to be by procurer based on the percentage of pregnant women overall that procurer will account for. Once these figures are entered, then the tool calculates the weighted average ex-work cost per bottle and the weighted average landing cost multiplier for that year based on the mix of procurers, the differences between the ex-work costs, the landing cost multipliers, and the percentage of product that is going to be procured through that procurer for that year. The tool then calculates the number of MMS units or bottles that are going to be procured by procurer by year. And this is calculated based on the percentage of pregnant women being supplied by the procurer and the number of MMS bottles required, which may differ in numbers based on the number of tablets per bottle. So again, these are all calculations, and this doesn't need to be manually changed. To get to the final product procurement cost, the tool pulls in the number of pregnant reached with the MMS from the Base Inputs tab. The number of product units for procurement is the same as the total of MMS bottles procured up here, but the extra buffer for product wastage is added to it. And then it multiplies it by the ex-work cost and the landing cost multiplier to understand what the total product procurement costs, landed cost in USD is. Then there's an option to add a landed cost additional buffer. This is an extra additional buffer allowance to account for variability of procurement and import costs, especially in the introduction years. So this can be zeroed out. You don't have to enter inputs here, but it is to help understand what the extent of extra costs could be and account for that in this costing of the implementation plan in the early years due to unanticipated or unaccounted for possible costs that could come out. Then the tool calculates in USD and converts for local currency what the totals are, which are reflected in this upfront table. The next tab is supply chain costs, and this goes back to the format of research and pilots and policy and regulatory activities. To note, routine supply chain costs should not be included. So supply chain costs outside of product procurement and routine supply chain costs included in distribution to facilities and to the end user should not be included. These are incremental costs to introduce and scale up MMS successfully in your country. So for example, this might be extra warehousing and storage, forecasting and ordering training, extra port or custom fees that can be estimated, technical assistance support to the government. We've put in some examples, but again, these are incremental costs to routine costs in the country. Training and service delivery is there to calculate the cost of training, mentorship, and other service delivery related activities that are healthcare worker facing only. And so subcategories can be entered based on what is to be included, including the different cascade of training from master training, subnational health facility training, community training, to mentorship and supervision at different levels, and can be updated and edited based on what's appropriate in your country. Here, the subcategory is selected, the training activity description is included, manually inputted, the type of cost is selected, and in what year it would be applicable in. We have more calculation aids here to help you understand what the cost of these training and mentorship and supervision activities would be. So the number of sessions in the year, the number of days in each session, the number of participants per session, and then in light orange here can be edited based on what's appropriate in your context for the per person costs. So for example, these could be per diems, local transportation, local accommodations, food cost, material supplies per participant. Again, these can be edited based on what's appropriate for you. And if one of these columns is not applicable, it can simply be deleted. Venue rental costs, any other activity costs should be entered here, and a description of what those other costs are. And then this will calculate what the total cost is based on the number of people attending, the number of sessions, the number of days, and your per person costs, as well as your fixed costs. If you're putting in an activity that is not training, mentorship, or supervision and doesn't have all of these columns applicable, you can simply put this here, for example, developing a training manual, and then you leave everything blank except for what the activity cost is going to be, which you put in other activity costs, and you can leave the rest blank. Then at the top, the tool will categorize and show you the totals by type of cost, by currency, and by subcategory. To note, please enter all the activity costs in USD, and the tool will automatically convert it to your local currency based on that currency conversion. Demand generation calculates the cost of demand generation related activities that are targeted towards pregnant women, their families, their communities, and any other non-healthcare worker audiences. And we've included an extra subcategory here in case you want to use it. So for example, subcategory 1 could be the type of activity. Subcategory 2 could be the audience to which that demand generation activity is targeted to. Please leave other activities and non-applicable here as a catch-all subcategory. So again, structured like a work plan where you can enter subcategory 1, subcategory 2, the activity description, type of cost, years that it's applicable in, and the total cost for that activity. Coordination and advocacy is structured the same as demand generation. So coordination activity calculates the cost of any MMS related coordination advocacy activity. These are primarily assumed to be stakeholder meetings, but other activities can be included as appropriate and across any function in the implementation plan. So all stakeholder meetings should be within this tab. And again, you can categorize them based on, for example, the meeting purpose, policy and regulatory, implementation planning and monitoring, financing, as well as a second subcategory, for example, the type of meeting. And you fill it out similar to how we described in the demand generation tab. However, in this tab, we have, like in training and service delivery, the ability to enter more detailed inputs to calculate the cost of what those meetings will be. The number of meetings, the number of days of the meeting, the number of participants, the per person costs, which again can be edited yourself, the venue rental costs, any other activity costs, and the description of those other costs. And this will automatically calculate what the total cost is. For any activities that are not meetings or don't require all those inputs, then you simply leave everything blank except for other activity costs. Local market shaping and monitoring and evaluation are structured as those simpler tabs where you have a subcategory and you simply enter the activity details and the total cost. Local market shaping includes any activities applicable to market shaping within your target geography, within your country or subnational geography, not at a global level. So for example, local manufacturer technical assistance could be an applicable subcategory. Monitoring and evaluation is any activities that have not already been included in any other cost categories. Several monitoring and evaluation activities might be in coordination advocacy as meetings, so those should not be double counted here. But for example, capacity building for M&E officials, implementation monitoring analysis and reporting, those types of activities can be included here. Then we move on to another part of the tool, which is being able to track funding and financing that's expected to be received or already dispersed per year from each funder. So in this tab, for each cost category, you can input a funder and then the amount you expect them to contribute or have already dispersed in that year. And you do that for each cost category. And you can see we've put in several dummy examples here. Then we move to the total cost output tabs. So first, this is a master tab that is not to be adjusted or manually overridden or inputted. This is simply a calculation set of outputs. There are many different colors here, but all of it should not be touched. And it calculates the totals per year for each costing category. It totals for each cost type, introduction, transition costs, and ongoing costs. And it automatically incorporates the inflation rate that we've entered in the base inputs tab. So all of these totals have been adjusted for inflation, and that's a major difference between these figures and figures you'll see earlier in the tool. We've also included subtotals and totals for the amount of financing that was tracked in this tab, the totals for total funding committed, and then also a calculation of the total funding gap based on the total cost for that year and the total funding committed and what the total funding gap would be. So on the left side is USD and on the right side is the local currency. Then this is a dashboard for your use to be able to easily pull common metrics that you'll want to see. Again, do not manually adjust any of the data in this tab. All the totals have been adjusted for inflation. And so you'll see from the top cost per year by cost category and year. On the left is USD and on the right is the local currency. And for each graph, we have the table of all the outputs that are within that graph to the right. So these can all be easily copy pasted into PowerPoints, presentations, or other sheets based on what you need them for. Second type of graph is cost by type of cost, by cost category and year. The third is cost per pregnant woman reached. So in the bars, number of pregnant women reached with MMS, and in the line graph, the cost per pregnant woman reached. Then it details the funding committed by cost category by year. And then the funding gap by year. So this will show what's funded and unfunded. In this example, there's a small proportion that's funded, so you can barely see the green, but it does show both funded and unfunded based on what the inputs to the tool are. And then you can look at the funding gap by cost category and year. You just select the category to see the funding gap. So this is for research and pilots. You can see what's funded and unfunded. If you change, then it will change based on what is selected. And again, all the output numbers are on the right-hand side. Then the last remaining tabs, again, are not meant to be adjusted. There are reference tabs that feed into those auto populations earlier in the tool. Pregnant women population pregnant women who have anemia, currency conversions, inflation rates, the states and provinces that are pulled, and the drop-down defaults. So these are pulled from sources that are noted within these tabs. And that's about it. Thank you for your attention during this tutorial. If you have any questions, feedback, or comments, please reach out to the R4D contact listed on the R4D webpage hosting the link to the tool and this tutorial. And we hope that this is useful to you. Thanks a lot.